80 or so this afternoon, 85. Chances of some showers and thunderstorms and much cooler tomorrow. Right now it's News Extra time and brought to you by First State Bank. And here's Rob Barney.
Thank you, Dennis. We have guests today from Regional West, and we'd like to welcome Paulette Schnell, the community health nurse, who is going to give us flu shots. Great video for Dave here. Dave, do we have a backup for you, just in case when you get your shot, you can't complete your mission?
You think I might pass out?
There's always that possibility, but we'll get flu shots here this morning. But first we're going to talk to Gitesh Chheda, radiologist at the hospital. Welcome, Doc.
Good morning. How you doing?
Doing well. You've got a fancy new piece of equipment that we need to talk about.
That's
a new
right.
MRI machine. Fill us in.
Yeah. Well, at Regional West, we actually have 2 MRI machines, and the newest one just came in. We've been doing a lot of construction, and they're both now working. They're both highly capable machines and both full-time machines, working Monday through Friday and even Saturdays. They're both high-level machines, but the newest machine just got FDA approved in October of last year, and we're very happy with the results and happy with the scans that we've been getting out of it.
Yes, first off, tell us exactly what an MRI machine does.
Yeah. Well, an MRI machine is basically a high-tech imaging modality that we use to basically scan the body, scan different parts of the body. And it's really useful in evaluating soft tissue structures like bones, joints, muscles, tendons, ligaments, discs. And it's really well done. And the newer technology comes out every so often, and it's just good to stay up to date with it.
So this new MRI machine is the latest.
That's correct. Yeah, it's the latest, and it's something that you're not going to see anywhere else in Nebraska, Colorado, Wyoming, South Dakota. It's basically the newest technology we have.
And this newest technology allows it to do what that the other one couldn't.
Well, it's got so many more new designs that we have. Its new designs include a wider bore, which allows for larger patients to go through. We've already had 2 patients that we normally would have to turn away because it wouldn't fit in our gantry, and we've already been able to scan them. Not only that, it has a higher weight limit than we used to have, so it can allow up to 550 pounds of weight on our machine. Also, it has a feet-first scanning, which basically allows the patient's head to remain outside of the machine, which causes less claustrophobia, which we know is an issue with MRI. The other thing we have is we've installed Sky Factory ceiling, so it makes the whole environment very calming and very easygoing for the patient, which is really useful.
So what is an MRI machine used for most?
Well, most it's used for is basically people who complain of pain in certain regions. Low back pain is a very common region. People who have knee pain or shoulder pain, just sometimes it's long-standing, sometimes it's more shorter term. But the machine is really good because we've installed it right next to our ER and right next to the ICU. So it's actually much more useful because it's very accessible for our more critical patients. But it's also can be done for patients who just have an outpatient and just continue pain to their doctor.
Back and shoulder pain. I think we need to go on location. Yeah, you just missed me falling off my chair out front.
Oh boy.
We'll be back with more right after this.
Very good.
Did we get
You're
the
doing a
bases
great
down?
job.
That's big.
Okay, Paulette, you're up.
Okay. So who's going to do this on the air? You, Rob?
I guess I will.
Then I'll get you later.
Dennis, do you want to do it on the right now, or
Just stick around. Okay.
Dennis will do it whenever too.
I got enough for 2 minutes.
We're back. Okay, it's flu shot time.
Yes, it is.
I'm smiling. Paulette Schnell, community health nurse, Regional West. Okay, flu shots. How come they're important?
Well, the flu is not what everyone always thinks. Sometimes they talk about the stomach flu, or just they don't feel good, so they think they have the flu. And really, we're talking about a respiratory disease that causes several people to miss, millions of people to miss work, to be sick, and to actually even death from pneumonia and other things that can set in after flu. So it's a thing that people need to take serious. And especially if you have any kind of already medical diseases, chronic illnesses, you need to be thinking about getting protected.
If you would have just cut it off after the missing work part, that would have been fine, because that's fine by me, but the other part's not good. So, what does the flu season look like this year, you think?
You know, we have the same flu vaccination as we did last year. It has the H1N1 in it, and it has 2 other kinds of protection against. It protects against 3 types of influenza. But some people are thinking, well, it's the same kind of shot. Do I really need it this year? But they do, because the immunity doesn't stay past a full year. So people need to get the flu shot again, and so we're encouraging people to do that. Some people try to predict what kind of flu year we'll have, and we never really know. Some people think that it may not be that bad, but we don't have any way to really predict that at this point. So the best thing you do is get yourself protected.
All right, let's get protected.
All right.
So, as you do this, when do people need to get their flu shot by for it to be really effective?
Well, you know, they used to say wait till later October or November because they used to.
Okay.
Because they were worried about immunity waning before the season was over. But now they do say to go ahead and get it as soon as the flu shot vaccine is available, or any time in the fall. But to get it done, and we see flu show up usually here about December through March is kind of our flu season. And sometimes it can show up a little bit earlier, but you need at least a couple of weeks to build that immunity. So it's great to get it done as soon as you can.
Okay. So
And we have that opportunity coming up.
And this is a real deal.
Yes, we're getting ready to do it, and we're going to give you your flu shots.
It's not a placebo. Okay.
You're not going to cry or scream or jump, right?
Hopefully not.
Okay.
No promises.
So when are you going to do it?
Well, it's all done. You
Wow.
didn't cry. I am going to put a Band-Aid on
Okay.
just in case.
So, how do they get a hold of you to take care of flu shots?
Well, actually, we have the first opportunity this Saturday. We're doing a drive-through flu clinic up at the hospital at Regional West on the campus there. And it is from 8 to 12, and our aim is at Medicare patients. So if they want to come up that way, they get to stay in their car, and you can bring people, up to 4 people in a car, and you can put your arm out, we'll give you a shot, and you're ready to go for the day.
Very good. Dennis is going to get his shot, and Dave, and I think up front Cheryl. So we're getting taken care of here at the studio. I think I've got some tissue pain on my arm, Doc. Do I need an MRI?
You don't.
No? Okay.
We'll be fine.
Very good. Well, we'd like to thank our guests for coming in today. Dr. Chheda, radiologist at the hospital, and talking about the new MRI machine. And Paulette, thanks for coming in and telling us about flu shots.